person is fully vaccinated, can they knowingly come into contact or live with the person who is in isolation or infected, and then to continue to interact with others at the same time, like going shopping?
Okay, so this is one of the things which is a little bit tricky, because the testing on the vaccine was done to find out that the person themselves did not get sick. On that, we have good data. We don't know 100% yet if it is possible that the vaccinated person has the disease. I mean, he doesn't have the disease in terms of being able to get sick, but it is possible for him to pass it on to others. We do have this kind of model from other viruses, okay, such as with polio vaccine. Those of you who remember one of our last major immunization pushes in this country, which is about 6-7 years ago, was to go back to giving the inactivated polio vaccine, the shot, as opposed giving the drops as opposed to the shot, because it was shown that using the shot alone could prevent people from getting polio, but didn't necessarily prevent them from being able to shed the virus. So we don't know at this point what the story is in this case. So we're kind of walking a tightrope. On the one hand, we know it is definitely going to help, and we want people to be immunized, and immunization is going to help in terms of the spread of the serious disease. However, we don't want, at this point, till we have more data, to just jump in and say that everything can go back to the way it is, because we don't know if you could be getting it and spreading it, all right? And that is why, if somebody has a known sick person in their house, that other person should be put in real isolation, should be kept separately. One should not be knowingly trying to be in contact with them and then in contact with other people, because that potentially could be spreading the disease. On the other hand, the person does not technically need to be in quarantine because they were exposed, because they were vaccinated.
Okay, so finding that balance.
Mhm.
If we have received vaccines out of the country, will they be recognized in Israel for quarantine exemption?
Okay. At the moment, the answer is no. Okay. It is one of the issues that is being discussed. There are two things that need to be decided here. Number one, which vaccines are going to be recognized, because there are many being given in different parts of the world, and one needs to decide which meet the standards to which Israel wants to make sure people are vaccinated. And the second is to make sure that the documentation that is being brought from other countries is accurate and there is no forgery involved. I mean, one of the things advantages that Israel has is that every single dose has been, put into a centralized system, and therefore it is hard for somebody to be able to say that they were vaccinated when they were not. Once you're coming from another country where you don't have access to the medical records, it's a little bit harder to be sure. This is something that's being worked on an international level in terms of international treaties between countries recognizing each other's vaccines. So in the future, there probably will be some sort of arrangement, but at this point, one should not say, oh, I was vaccinated in the States, I don't have to worry, or some any other country, because they're not being accepted at this point.
Are non-Israelis eligible for a green passport after getting an Israeli vaccine?
Okay, so anybody who was vaccinated, I have to go back again to the concept of the green passport, and they may even change the terminology, because there's been objection to using the terminology of passport, because it makes it sound like you're entitled to something. There is, as I mentioned, a process underway saying that if you meet certain criteria, then you will be allowed into certain events. One of those criteria is vaccination, in this country as of now. Other options are being tested, okay, soon before the event. other possibilities are being able to prove that one actually has had the virus, either through having had a positive PCR test or having positive serology.
We're going to get to that later, though,
of-
the serology questions.
Yeah.
Okay. How can children travel safely, relatively safely on an airplane, considering they can't get vaccinated, as far as implications of the vaccine?
They should wear their masks while they're on the plane. Okay. Interestingly enough, apparently the air exchange on airplanes is far better than we think. So it's not being on an airplane that is the biggest risk. The risk is much more the issue of being at the airport with other people. And the way at this point to protect children is to make sure that they are wearing their masks, that they are keeping 2 meters away from people, that they're not being in big congregations, and as many people that they're with on a day-to-day basis are immunized, we're also minimizing the chance of them at least catching it from family members.
Okay, please continue. Aren't children able to get the vaccine?
Okay, so children, every time one tests a new medicine, one tests it on certain populations, and sensitive populations often are not part of these studies, okay? Therefore, in the original studies, for example, pregnant women were not put there, just because no one wants to do an experiment on pregnant women. And the same way, people don't want to do experiments on children under 18, if for no other reason that it technically gets very difficult in terms of getting informed consent, because you can't get informed consent for the person doing it. You have to get it through the parents. It's much harder to get approval for it. So it is not uncommon for things not to be tested in children, something that all pediatricians are aware of, because many of the drugs that we use have never technically been approved for use in children that we're using it in all the time, because people just don't do the studies. So of the 2 vaccines, one of them was tested up to age 18. One of them was tested from 16 and above. There are studies at the moment testing ages 12 to 16. And the policy at the moment is that we are not giving it to children, except for certain rare exceptions for which one has to apply. And the rare exceptions are primarily related to people who have significant medical conditions that put them at particularly high risk.
Well, when will people who had corona be able to get the vaccine?
There is no rush at this point to try to give the vaccine to people who already had corona, because as far as we know right now, it does not provide any additional benefit over those who have had the natural disease. So it's a question that gets looked at, but I don't see it happening in the near future. Certainly the emphasis is going to be first to make sure everybody has been protected in one way before we start wondering whether we should be doing double protection or not.
Are there specific concerns about young adults or teenagers receiving the vaccine? I know you're going to talk about fertility later, but are there any other concerns?
No, there are no other concerns.
Can non-Israelis get vaccinated? We could answer this very briefly if you'd like.
Okay, at this point, there is no way for someone to get it without going through some kupat cholim, because all the arrangements that the government is making for the vaccines are either through the kupat cholim or through the army, but that's another, the army gets its own vaccines and deals with it within its own health service. So there are tourists who have insurance through the kupot cholim, through the health funds, and as in anyone else who's covered by the health funds, they can be covered. There is discussion about making sure that people who don't have kupat cholim and don't have any other insurance, such as undocumented workers, will get the vaccine so they can't spread the disease to others. There are certain cities who've been trying to make sure that they have these undocumented workers done. But pretty much the way at the moment for somebody who is a tourist is to have insurance in some manner, shape, or form through one of the health funds.
Thank you.
the worries start from in the beginning, as in many things. It started with fake news, saying that there is a protein that is in the spike protein, which is the basis of the vaccine, as we described before, is similar to a protein that is in the placenta. All right. This was looked at. If you take any two proteins, you'll find some similarity between them, because you realize that every protein is made out of 20 amino acids. So there's a limited alphabet that's writing this book, but that's, similar to taking any two books and saying there's overlap because they've used some of the same words in them. Okay. So that in itself makes no sense. And the fact that the body is making antibodies at the time a woman is pregnant is not a problem, because that's what the body's supposed to do. It's supposed to make antibodies to foreign proteins. Okay, so that gets to the next step, okay, in terms of, we don't think that the vaccine does not affect fertility, the disease does, therefore it is better to be vaccinated. Well, if I'm planning pregnancy, should I be waiting till a certain time after I have the vaccine before I get pregnant or not? And here too, the science is there's no reason to wait. Okay, we don't have any reason to fear this vaccine. We don't have any reason to think that it would be possible for it to produce any kind of birth deformities, because, as I explained at the beginning, it has no virus, not a live virus, not weakened virus, not even part of the virus. So it makes no sense that it could cause any effect on the developing fetus. In addition, the way the vaccine is given, it's given inside muscle tissue, and it disintegrates in about a day. Okay, basically the body's immune system reacts to a foreign protein that was there for about a day, or not a foreign protein, about the foreign protein that was made by this recipe that was given, and the immune system is meant to work during pregnancy. And we do have many other vaccines that are given during pregnancy, such as tetanus, such as pertussis, such as influenza. And therefore, there really is no reason to fear the virus. Okay, and last but not least, we'll go on to breastfeeding. Here also, that first letter that came out from the Ministry of Health said that it should not be given to lactating women, and everybody was like, why not? Okay, it makes even less sense. Okay, when we're pregnant, we have a developing fetus, and you could try to think, I don't want to take any chances whatsoever, because there's so many things we don't take chances of in pregnancy. But in breastfeeding, it made no sense that there should be a risk from this vaccine. Take the worst.
Do people with lower antibody counts have more chance of reinfection? Once you're positive, is there a significance to the number?
Right. As far as we know, once you're positive, there's no significance to the number.
Okay. And do you believe that the current state of serologic antibody testing is accurate? Does it measure to all the different strains that are going on now?
So there is no. First of all, I'll point out that nobody has proven to this point what the implications are to the serology tests that exist at this point. So we are using them as a proxy for a vaccine, for the fact that you don't have to go into quarantine, but that's it. Okay? And that's all we know about serology. It's a useful tool for research. It's used for those purposes. But one should not read more into it than we do at this point, which is that it helps you in not having to be quarantined under certain circumstances.
Okay. Okay, now we have general questions. I think all the other questions we had for serology you answered. I have a few questions. I'm going to actually answer a couple of them myself because they're gap year questions. How will the vaccine affect gap year students' ability to re-enter the country after Pesach? So a lot of students have started getting vaccinated, and the answer is this is not a Ministry of Health question. This is a question for the Ministry of Interior, for MASA, For the schools have to get reentry permits. And of course, we don't know what the policy will be in terms of the airport being open or closed. As we all know, Israelis aren't even allowed into the country now. So if you have a certificate of vaccination, which all Kupot Cholim will give you, it's in your account online, then that will count the same for anybody who has it. Will students who test positive for COVID be eligible for vaccines at some point? And the answer is, it's not available for Israelis right now. When things change, then there's no reason to think that someone who's not eligible for a vaccine won't be able to get the vaccine. But right now, people who've had corona are not eligible to get the vaccine, and that may change, of course. But it's a little early.
It may or it may not.
It may, right?
Because
things can change. We just don't know. And if someone in a yeshiva, this is for you, Dina, if someone in a yeshiva tests positive for one of the variants, does everyone have to quarantine even after they've already had COVID or they had the vaccines?
Okay, so at this point, with the variants that are known to us today, we are treating them that immunity to one leads to immunity to the other. The biggest difference that we're seeing at this point is the rapidity of spread with some of the newer vaccines. We are not seeing that it means that you can get it again, but these are part of the things that one has to stay on top of all the time because things can change.
Okay. Do you have general suggestions for strengthening your immune system to help people repel COVID-19 more effectively?
I would say all the things your grandmother probably would have told you to do. Get a good night's sleep, make sure you're exercising, try to eat healthy, all kinds of things to keep your body in good, in good kind of shape. There's some indication that, taking vitamin D to prevent having low vitamin D levels may be helpful. But beyond that,
if people are actually staying home and not getting a lot of sunlight, probably not a bad idea anyway.
Right.
What are the options for people who are bedridden to get the vaccine?
This is something that needs to be arranged through their kupa.
So their kupa is responsible to arrange for them
to
get the vaccine.
The kupa is responsible to arrange it. Different kupot do it in different ways, but it is something that, is possible.
Can I get the vaccine, 2 different doses of the vaccine in 2 different countries?
Well, you have the problem that it won't necessarily be recognized in Israel, because at this point we are only recognizing the ones that are given in Israel. So,
okay. Another question, and this is the hot topic of the month. If we have the highest vaccination rate in the world per capita, why do we have continued high numbers of new cases and deaths compared to less vaccinated European countries?
Because, there's a race going on, and on the one hand, we are vaccinating lots of people. However, to be able to the point that that the virus cannot spread, we need to get a lot more of the population. As I mentioned, part of our population can't be vaccinated because they're children. And in this, we're different than other countries because we have so many children, Baruch Hashem, in this country. And some of these new variants and the pace at which they are spreading has made it more challenging than we expected it to be. I don't think in any way it shows that the vaccine is not effective or that the vaccine is not part of the strategy. It just means that unfortunately the strategy is taking longer than maybe we had hoped back in November.
Absolutely. What are the implications of school reopening with children not being vaccinated? This is your area.
One has to worry about having spread of the disease exactly like we've had every other time we've come back from lockdown. And that is why we have to hope that this time it will be done in a stepwise fashion, starting with the lowest risk groups, which are the youngest groups, the ganim. The one thing that may help us in this is the fact that the teachers are vaccinated at this point could help with some of the spread of the disease, because many school outbreaks involves spread from teachers to students and around like that. So hopefully that little part will help us, but it means that we really need to be careful when they're going back to school. Hopefully making surroundings like smaller classroom, less children in the classroom at the same time would probably make a major contribution to reducing the illness.
If someone has had corona and they're still having some respiratory symptoms weeks later, are they still contagious?
In general, the feeling is no. We feel that after the first week is over, most of the contagiousness is gone. But to decide when somebody, excuse me, but to decide when somebody can get out of, can be released from the house includes a conversation with the doctor to see how sick he was in the last 3 days. So if he had a really bad cough at the beginning and he has like a improving lingering cough, that is not considered a reason not to do it. On the other hand, if he's still sitting there like hacking and hacking, then he's not yet better yet, and he can't come out till things have gotten a little bit better.
So more severe symptoms.
It's the severe symptoms, and it's partially in terms of, are we in the improving direction or are we on the not in the improving